We begin tonight with a major development in the state's COVID crisis. 3 LGAs, including Orange in the state's central west, are going into lockdown from midnight. It's the first regional lockdown in this outbreak and follows a confirmed case of coronavirus in Blayney. Let's go live to Joanna Woodburn in Orange. Jo, this is going to hit hard there.
Indeed, Jeremy. It's something that all regional communities have been bracing for, but certainly hoping wouldn't eventuate. But it has indeed today for the Central West. So Orange, Cabonne and Blayney, these 3 local government areas which are side by side. It's all been prompted because of the number of venues of concern that have been listed by New South Wales Health. There are 5 in Orange that have been released tonight. There's the Woolworths in North Orange, a petrol station, a tobacconist, the Pizza Hut restaurant and the Officeworks shop. So all of those venues were visited by the man who's tested positive on Friday, July the 16th and Saturday, July the 17th. There are some additional restrictions. Funerals have been cancelled. Funerals have been limited to 10 people and weddings will be cancelled from Friday, but there's a 2-day grace period. Here's how the day unfolded.
It's been a testing few days for regional communities, and now the news they've been dreading. The first locally acquired case of COVID-19 during the current outbreak has been found in the Central West.
I can confirm that we do have a case that has been diagnosed associated with the exposure of the truck driver.
A security guard working at this pet food factory is among 8 people who were exposed to a delivery driver last week. They've been isolating since Sunday when the site was closed for cleaning.
There's no doubt it's been a concern, but the response to the COVID testing has been excellent. Hundreds of people have come through the last couple of days.
The Central West isn't the only regional area on alert tonight. A person who visited a house at Cootamundra in the Riverina has also tested positive to COVID-19.
A mobile testing site has been set up at the local showground. Pop-up clinics are also springing up in several towns after people with COVID-19 visited the west, south and north of the state. New South Wales Health has now updated its working from home advice for those outside lockdown areas.
And I would encourage employers in the regional areas to try and allow your staff to work from home.
And truck drivers forced to comply with new requirements have faced a shortage of kits at some freight testing sites. Transport officials say they're working urgently to ensure they're stocked amid the unprecedented demand. Joanna Woodburn, ABC News.
COVID's grip on the country is ever tightening. 14 million people across 3 capital cities are now in lockdown. Melbourne and Adelaide are staring down an uncertain future. We'll have more on that soon. Gladys Berejiklian says within days we should know if Sydney's on track to end the lockdown next week. The state has recorded another 78 COVID cases. That's a slight improvement on recent days, but there were 21 cases infectious in the community, along with another 8 for some of the time. Here's state political reporter Ashley Raper.
Day after day, people have been playing their part, but it's pushing the system to the limit. Laboratory pathology hasn't been able to provide test results, in some instances, for 4 to 5 days.
I'm 24 weeks pregnant. I was waiting all weekend, getting sicker, and by Monday I was just really sick and needed to see a doctor, but I knew I couldn't without a COVID test.
One of the private labs in particular did have some issues with scale, and you can imagine that it's been a double-edged sword. We're really pleased to see the community response to the testing.
But Dr Chant insists the issues have been addressed.
They've put in a lot of additional measures to call upon other lab capacity in other states.
There are 78 new cases. 49 are linked. There were at least 21 people infectious in the community and a further 8 out for part of their infectious period. 52 cases are from southwestern Sydney.
I am concerned about the emerging risk in Canterbury, Bankstown, local government area. There are a number of cases there, and there's also a number of exposure sites.
The growing number of people in hospital is also causing concern. 95 people are now in COVID wards. 27 are in intensive care and 1 is a teenager. 11 are needing to be ventilated.
COVID is a very serious disease. We are seeing more hospitalisations, more admissions to ICU, more people on ventilators. We have to stop the spread of COVID.
For those feeling the financial consequences of the lockdown, business grants started being processed yesterday, even though the site for applications crashed.
Whilst the system had some challenges in the morning, by the end of the day, nearly 6,000 businesses had their applications processed for support.
The Premier delivered good news too for the construction industry.
There'll definitely be construction activity on the 31st of July, I can give you that assurance.
So while it appears there's certainty for construction workers, there's uncertainty for everyone else. But the Premier says in a few days we should have a better idea of what the future will look like at the end of the lockdown extension.
The green shoots are there, and I'm convinced that in the next few days we will start seeing hopefully more improvements.
Compliance, though, remains an issue.
7 people in a small office suite, birthday cake, alcoholic drinks, birthday food, and a person passed out on the floor.
Those people were fined, and overall 160 infringement notices were issued in the past 24 hours. Ashley Raper, ABC News, Sydney.
As we've just heard, Canterbury Bankstown is emerging as a concern for health officials. Kathleen Calderwood is at one of the testing clinics in the area. Kathleen, how are locals responding to these new warnings and alerts?
Well, Jeremy, driving around Canterbury Bankstown today, it certainly does seem like people are listening to that request to go and get tested. We're here at the Canterbury Hospital, which is one of a few clinics that offers testing late into the evening, and there's at least 50 people here lined up waiting to get tested. The pharmacist across the road has told me it's been like this every night since Sunday. Kerry Chance said today that she's concerned about this area, and she asked specifically for people in the suburbs of Belmore, Lakemba, Punchbowl and Yagoona to go and get tested. Now, we went to a clinic in Belmore today, and the GP there, Jamal Reefy, told me that yesterday that clinic broke its record for the most number of tests it's conducted in any one day by more than double. And he said that while that is encouraging, it's also not sustainable, especially when his staff are spending a lot of their time helping patients fill out forms that Dr. Reefy says are ultimately far too complicated when there's such high demand for testing.
Our staff are getting tired, and our staff working long hours, and unfortunately they are spending longer time with each patient who came in.
We've also had access to some recently released modelling from the University of Melbourne, which is looking at how long it will take New South Wales to reach a 2-week average of 5 cases per day or less. And it's found that under the current lockdown restrictions, that could take until early September.
Kathleen Calderwood reporting. Well, Greater Sydney will be joined by more than 8 million other Australians in lockdown for the next week. We have reporters in both Melbourne and Adelaide tonight. First to Nicole Asher. Nicole, Victoria's Premier had promised a short, sharp lockdown. What happened?
That's right, but the Delta strain is still spreading down here. There were 13 new cases confirmed in Victoria today, and the Premier, Daniel Andrews, says the lockdown has to be extended to avoid what's happening in Sydney. Victorians have been ordered to stay home for another 7 days, and it'll be harder for Victorians wanting to come home from across the border in New South Wales, with the travel permit system suspended for a fortnight. Jeremy.
Let's go to Stacey Lee in Adelaide. Stacey, it seems Sydney could also be responsible for South Australia's lockdown.
Yeah, that's right, Jeremy. It's believed South Australia's original case could have caught the virus at either the RPA hospital in Sydney or in a taxi on the way to the airport. And South Australia's cluster has now grown to 5. So health authorities here say they had no choice but to lock down the whole state for at least a week. And the new rules here are even tougher than those in New South Wales and Victoria. People can only travel within 2.5 kilometres from their home for 90 minutes a day to exercise. And like in Sydney, construction is banned. Jeremy?
Stacey Lee and Nicole Asher reporting. With so many people in lockdown, let's take a look at how vaccination rates are going. Nationally, almost 10.3 million doses have been administered, with 36% of the population aged over 16 having received their first dose. In New South Wales, 34% of the adult population has received the first dose, 13% have received both doses. Over the last few weeks, many Year 12 students in Greater Sydney have been studying for their HSC trials, but most still don't know if or how they'll go ahead. It's an added anxiety they don't need. Some students feel unprepared and are worried about burning out.
Students all over Sydney, desk-bound at home. The tedium of study is barely tolerable at the best of times.
What separates the cell from the outside world.
And online classes aren't for everyone.
I feel like I don't learn anything. Like, it's not as productive. I just feel like the day kind of goes to waste in a way.
It's the lack of certainty for Alyssa Mina, who feels she really needs face-to-face teaching before her HSC trials.
Like, we weren't anticipating going into lockdown like in our last term, just before our trials. So I think we all kind of relied on the fact that we were going back to school.
Schools have been given the green light to postpone exams or develop substitute assessment. Some are pushing ahead in person, others a wait-and-see approach.
Scroll down to essential resources.
2-3 weeks ago, I started ramping up my studying and my hours. But like, if that's going to just get extended, like, I'm just going to get, like, I won't have any energy to keep studying.
Imran Afuni is fearing burnout if his exams are pushed back. It's a feeling shared by twins Alma and Alana Tamerji.
What if trials is further away? We're going to be studying even more and more. And that's just going to be that's going to be too much for us.
Your muscles subconsciously feel that.
At this rate, if the lockdown ends as scheduled, Chloe Montgomery will walk straight into her first exam mere days later.
Everyone wishes the trials would be pushed back further because it's kind of getting harder the more uncertain and the more the lockdown gets extended and worsened.
While schools have been given flexibility, those in Greater Sydney have been advised not to hold trial exams this week or next. Students fear if their exams are moved online or turned into assessments, they won't feel fully prepared for finals.
Because when we go to the HSC, we're just not going to be ready at all, because trials is like a little preparation for the actual HSC.
As if Year 12 needed any more stress. Tim Swanston, ABC News, Sydney.